Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello and welcome back. This is Adam Rosen, and you're listening to the Total Knee Tips and Pearls podcast. If you enjoy what you're hearing, please subscribe so you're going to get updated of future episodes, and leave a review that helps other people like you find this podcast. So keeping with this theme that we're going on is just reviewing some of the classic articles and discussing some of the classic classifications. This one is, one of those ones I think is important to know, probably more from an historical standpoint. But it's also one of those ones that, as a medical student or a intern or resident, you may get pimped on it. So it's good to know it. And this, what we're going to talk about here are the changes that you may have heard of called Fairbank's changes. So the journal article was entitled Knee Joint Changes After Meniscectomy, and this was by Dr. Fairbank. This was published in JBJS British in 1948. So you have to think back. We're talking almost 80 years ago that, the technology and thinking was a lot different back then. So the meniscus was not felt to be an important part of the knee joint, so it was typically excised if it was causing pain. And he was sort of ahead of his time in, when you read through this article, just how he thought of the meniscus and what he drew from this information and study really kind of show that he was a very forward thinker. So what he did is he looked at a number of his patients that were anywhere from 3 months to 14 years after meniscectomy. And what he found was that he believed that the changes noted on these x-ray findings were actually due to the loss of the meniscus. And he felt that that was because the meniscus served a weight-bearing function. And, although we all know as far as the knee and the levels of constraint, whether or not you're talking about the cruciates or the meniscus, we have a so much better understanding of knee kinematics and what can happen with injuries. But back then he was ahead of his time, and it was actually counterintuitive to what a lot of people thought. They really didn't believe it had any weight-bearing function. So even radiographically, what he found was that changing the x-ray from a supine non-weight-bearing view to an x-ray with a weight-bearing view, that can change the space by 1 millimeter. And what he also found, which I thought was actually quite interesting, was that if you then x-rayed these people at the end of the day, after they had been on their feet all day, you would actually lose another millimeter of joint space. So, it really kind of shows the dynamic capabilities of cartilage within the knee. So what he found and what he noted radiographically, and these are these changes now radiographically that have really borne his name, are when people had an open meniscectomy. And again, although you're not going to be performing typically an open meniscectomy, you may do a subtotal meniscectomy in a severely degeneratively torn meniscus. But the old days where people would open up the knee, do an arthrotomy, and do a full open meniscectomy are sort of long gone. But we still see those patients, that had the open meniscectomy many, many years ago. So what he found was that you saw this ridge formation along the edge of the joint. That was number one. Number two was a narrowing of the joint space. And number three was a flattening of the femoral condyle. And that's probably the most classic sort of question that you might get asked. But, knowing that there's ridge formation, that there's narrowing of the joint space, and there's flattening of the femoral condyle. And this can occur on the medial or lateral side, or both, depending on where the meniscectomy was performed. But these were all changes that were seen after open meniscectomy. So, what he sort of concluded then was that this meniscectomy, which was commonly performed, when people had problems with the knee joint and the meniscus was torn, but he found that the meniscectomy is not innocuous and that it could interfere with the joint mechanics. And again, really ahead of his time. People took it out thinking that it wasn't an important part of the knee joint. And he also concluded that it seemed likely, this is kind of his words, it seemed likely, quote, end quote, that the narrowing will lead to arthritis. And it's one of those things that we do know now, that, this injury to the meniscus can, whether or not you have a meniscectomy or not, can accelerate the progression of arthritis in the knee joint itself. So again, Fairbank's changes, first described in British JBJS 1948, And the three classic changes that he saw radiographically after open meniscectomy were number 1, ridge formation, number 2, narrowing of the joint space, and number 3, flattening of the femoral condyle. So once again, thanks for listening. If you have other friends, colleagues, co-residents, students that you really think would benefit from this information, share the podcast info with them so they can get the information as well. And until next time, stay safe. You've been listening to the Total Knee Tips and Pearls podcast. I'm Adam Rosen. Thanks for listening. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.